Yeah, it's been really amazing, and I think it's a good time in the field because we've got options now, official prescriptions that we can use,
Yeah.
and there's many more things that are under development.
Hey everyone. As you guys know, I was diagnosed with eosinophilic esophagitis 7 years ago, I think now, which is wild. And my journey, like learning about it and figuring everything out, cutting foods out, led me to starting this page, Phil Hates Gluten, and led me to living the life I'm living now, with EoE. So, EoE is a lifelong disease, and we're still learning a lot about it. And I know I'm still learning a lot about it. Like every month, I feel like I learn something new. And so that's kind of what we're doing today. We're learning, and I'm really excited to talk tonight to a leader in the field of EoE, Dr. Dellon. We're going to talk about EoE, its link with other type 2 inflammatory conditions and more. So we'll be doing like a 20-minute Q&A. I have a few questions prepared, but people in the chat, if you have any questions, like as we're going, like we'll try to answer them if we have time. So feel free to pop them in there. Um, this session was developed by Vindico Medical Education with an educational grant support from Sanofi and Regeneron. There's more project information can be viewed in the link that I put in the comments. But yeah, to no further ado, it's my pleasure to introduce Dr. Evan Dellon, professor of medicine and director of the Center for Esophageal Diseases and Swallowing at the University of North Carolina School of Medicine in Chapel Hill. And I'm proud of myself for not stuttering or messing that up at all.
No, that's great. Yeah, thank you. It's great to be here.
Yeah, Dr. Dellon, welcome. Everyone in the chat say hi to Dr. Dellon. Warm welcomes. Yeah, I mean, I'm, anything you want to say before I kind of get into the questions?
No, I think this is it's a great opportunity to talk with you and hear what other people think, and hopefully provide some good information.
Yeah, I'm super psyched. I'm familiar, obviously, with your name in the EOE space because with being involved with Cured and stuff. So it's exciting to talk to you for the first time, and I'm looking forward to it. So yeah, so I guess we'll start off with the basics here. So for anyone that's not super familiar here, because a lot of my followers do have celiac disease or gluten free for other reasons. A lot of them do have EOE, but could you just describe eosinophilic esophagitis and what signs to look out for?
Yeah, so eosinophilic esophagitis, we call it EoE because otherwise we'd be here all night trying to keep saying
Yeah,
the saying the name.
yeah,
But
yeah.
it's the way that I think about it is it's an allergic problem of the esophagus, and you can think about it as asthma of the esophagus or eczema of the esophagus. And it's a chronic condition, but there are lots of good treatments, as we'll talk about. But essentially, what we think happens is people react to either food or environmental allergens that irritate the esophagus. You get a lot of inflammatory cells, swelling, irritation in the esophagus, including with eosinophils. Those are one of the allergy type of cells that are in there. And that leads to symptoms and long-term other problems like scarring of the esophagus. And so when you think about the signs of it they can really change with age. So for people who are, adolescents or adults, typically the most common symptom is a sensation of food going down slowly or sticking.
Mm.
Um, but people can have heartburn or chest discomfort as well. If you're a child, you might have more symptoms like abdominal pain, vomiting, regurgitation, heartburn, trouble eating, like feeding difficulties, and even trouble with nutrition and growth. And so the tricky thing is all of those symptoms, even the trouble swallowing, can be caused by lots of different conditions. And so that's where it kind of makes it tricky to get a right diagnosis sometimes.
Yeah, and no, it's interesting. But I was diagnosed as an adult when I was 24, and I had those issues you said: food going down slow, food getting stuck. I had heartburn, heart palpitation, all this sorts of stuff that I never felt before. But it is interesting because talking about EOE, I have people who do reach out with children who have EOE, and it's totally different symptoms, like you said. So it's like hard for me to like. I mean, I don't try to provide any sort of medical advice, but it is just different because my experience was as an adult and I had those kind of clear cut, like food getting stuck. Okay, what is going on here? So it is interesting to learn about the symptoms to look out for in, kids. Um,
Yeah, yeah, and I think what's also interesting is a lot of times when the food gets stuck, people may just say, "Oh, I took too big of a bite," or
Yeah, yeah, yeah.
"Oh, that was
Ate too
too
fast.
overcooked. Yeah, I ate too fast," and ignore it for a long time. And many people I see have had symptoms. If I ask them really to think back, 5, 8, 10 years or more, and that really delays the diagnosis. And so I do think
Hmm.
people should realize if food is getting stuck, that's not normal.
Yep.
And most people, if they take too big of a bite, it still will go down.
Yeah, yeah. It's interesting. I mean, even I think about 5 years, 10 years before I was diagnosed, and I definitely had like little signs, but you're right. It's just you kind of brush it off like, oh, that was weird, and then like whatever. But yeah, so great to mention that. Could you tell us a little bit about T2 inflammation? Like, and you mentioned eosinophils and how that's, connected with EoE. You touched on it a little bit, but I guess a
Yeah,
little bit more would be great.
sure, sure. So type 2 or T2 inflammation, you can think of this as allergic inflammation.
Okay.
And
Yeah.
there are several types of inflammation. There's a type that's more autoimmune, and there's a type that's more allergic. So type 2 or T2 is a more allergic kind of inflammation. And what really that means is that things that cause allergies, whether they're causing allergies on the skin or in the lungs or in the esophagus, they all have very similar allergy factors in the body and certain inflammatory cells that are all involved. And so, for example, if you look at someone who has eczema and a biopsy of their skin and someone who has EoE and a biopsy of their skin, it looks very, very similar. And
Wow.
if you do lots of tests on it, you'll see all the same kind of factors. So that's what that general category of type 2 inflammation is. And in terms of an eosinophil, this is actually a normal white blood cell that's in your body. And people normally have this in low levels in their blood, low levels in their stomach and intestine and colon, but we never see them really in the esophagus. And these days, if we see them in the esophagus, it's most likely EoE and an allergy process. But there are some other conditions that can lead to the eosinophils there. So on the medical side, when we find them, we have to make sure, is it EoE or is it a different cause of eosinophils there?
Yeah, yeah. And like on the type 2 inflammation front, you mentioned, asthma, eczema, um, even like food allergies, like I have a shellfish allergy and I found that out before I was diagnosed with EoE. Um, like is could you talk a little bit more, like I guess about like the like why those conditions show up together sometimes? Is it because of what you're talking about here?
Yeah, yeah, it's really interesting. I would say the large majority of people with EoE, about at least two-thirds to three-quarters, will have at least another allergic condition,
Yeah,
or
wow.
another one of these type 2 conditions, which could be asthma or eczema or nasal polyp allergic kind of disease. And there's a thought that people will ultimately have sort of this allergic predisposition, and so there's something called the atopic march or allergic march, where kids might have start as babies with eczema and then they might develop food allergies and then asthma. And a lot of times, they'll grow out of eczema and food allergies and asthma. And then ultimately they get environmental allergies and EoE. And so it's all sort of related processes that evolve over the lifespan. So someone can have an allergic predisposition and have a history of these conditions, or actually have them all at once. And for you, like having, a food allergy, a true reaction where you might have throat closing or anaphylaxis to shellfish. It turns out that about 1 in 20 people with that kind of food allergy will have EoE. And that's
Wow.
like way more than like one in
Yeah.
700 in the general population. And so that's something that I look for as a clue. So if I see somebody who has a food allergy problem and also has trouble swallowing or other GI symptoms, I'm thinking about EoE pretty closely.
Wow. I mean, it's fascinating to think about. Yeah. I mean, all this for me, it's like all came on in like my 20s is figuring out all this stuff about me. But like again, looking back to even my teens and stuff, I had weird things to look out for, and it's just it comes to a head eventually, and like you said, it kind of builds. Um, so with EOE, like you mentioned how it's food or potentially environmental triggers. Some people. Well, I guess I don't want to run on your answer. Could you tell me a little bit about like with EOE, like um, kind of the method for potentially treating with like diet versus medications? Is it a thing, one or the other? Is it something that you can do both? Just any insight on that would be great.
Yeah, yeah. So once we have the diagnosis, we talk about whether people want to do, say, diet elimination treatment or a medicine, and it's natural to say, okay, well, if EoE is caused by food allergies in a lot of people, what should I avoid, right? That's what you do, right? If you're allergic to shellfish, you don't eat shellfish. The problem with EoE is that right now we don't have great tests. Actually, we don't have any tests at all to say what foods are triggering the EoE. And so the typical tests that an allergist might do, like those skin prick tests or blood tests, are not very accurate at all for EoE triggers. On the other hand, we know what the most common food triggers are for EoE, and those are things like dairy and wheat, um, egg and soy, and then maybe a little bit less so nuts, tree nuts, peanuts, shellfish, and then other things. And so people may choose to go on what we call elimination diets, where they just pick empirically, like, if you just get rid of all dairy and all milk protein, maybe about 40% of people are just going to get better doing that alone. And so we often talk about that, but it's a personal choice. Some people really want to go down that route and avoid food allergens. Other people hear about the diets and they're like, I can't do it. Like, right, I've just started college, I'm eating in the dorm, or I work for travel, I travel for work every week. There's no way that I can be so careful with my foods. So that's
Yeah.
sort of how that distinction comes down.
Yeah. So with the kind of the latter there, could you talk a little bit about like the options for people with EOE? Because I know like this is one thing that I've noticed since being diagnosed. It's like there's work being done for more options for treatment, which is really exciting. And I know that's happening with celiac disease too. So it's just like super exciting to be in, like for me, like very involved in it the last 7 years and seeing the progress. Could you just talk a little bit about like I guess some options for people with EOE?
Yeah, it's been really amazing, and I think it's a good time in the field because we've got options now, official prescriptions that we can use,
Yeah.
and there's many more things that are under development. So when we talk about medicine treatments, typically we're thinking first off of things like proton pump inhibitors,
Hmm.
which we all think of those as like anti-acid medicines, but they actually have an anti-allergy effect in EoE. And they block some of those T2 allergic factors that draw eosinophils to the esophagus. They're inexpensive, very safe, and so that's often a nice first choice. But those are off-label; those aren't officially approved for EoE. The second thing is a topical steroid, and here the idea is to coat the esophagus with like an anti-inflammatory steroid, and I kind of make it akin to like rubbing cortisone on a bug bite, where it takes away redness and irritation. But we can't like rub a cream inside of your esophagus, and so instead we've been doing syrups. And like for years, we were using asthma medicines, for example, like budesonide or fluticasone, that, and you may have done this, where you have to adapt it yourself and make what I would call home brews to get this stuff coating the esophagus. But about a year and a half ago, now we had the budesonide oral suspension that was approved for EoE. It's an esophagus-specific medicine that's quite effective for people. And then also, we have dupilumab, which is a biologic, which we'll talk about, but that's another medication that's now FDA approved and can be very effective for people. And then there are a number of other medicines that are being tested in clinical trials. And so these have different ways to try to treat the allergic condition. And some of them are already being used in eczema and asthma, and we're repurposing them for EoE, which lets us move pretty quickly to test them out.
Yeah. Yeah, that's like the biologic dupilumab. That's obviously been like a lot like a hot topic of discussion with EOE because that is very exciting. Like it happened a year or two ago. Could you tell me like who like what would make you kind of consider going that route of the biologic maybe versus the other options we're talking about, the newer
Yeah,
option?
yeah, for sure. So if people don't know, a biologic is a different class of medicine. It's actually a protein, a bioactive protein. And in this case of dupilumab, it's an antibody. And so it's a protein that is given by a shot that you would give yourself, and that blocks some of those type 2 factors. In this case, there are allergic factors called IL-4 and IL-13, and those are really involved with causing EoE. And interestingly, those are also involved with causing asthma and eczema and allergic polyp disease and some other conditions too. And so when I think about using this medicine, we have guidelines for when to use it. Most commonly, because this is a weekly shot for EoE that you've got to give yourself, and it tends to be pretty expensive. Right now, the practicality of it is many insurances require it to be sort of a step-up medicine, meaning that you haven't done well or you haven't tolerated well medicines like PPIs or topical steroids. So I would say that's the typical time. However, our guidelines actually will say that if you are somebody who might have asthma and eczema, both are indications that dupilumab is approved for, and you've got EoE, that might be a time to consider using that earlier. And
Yeah.
so that's sort of how we, how I think about using it. And of course, there's going to be, some preference or a lot of preference for patients, right? All of our other medicines are often twice a day, and this is once a week. So it may be very much easier to do this, to take it once a week instead of something twice a day.
Yeah. Yeah. I mean, yeah, it's interesting. Like you said, it's like a two birds situation potentially for some people. And you mentioned the step up part, like with EoE symptoms, like we can, flare ups happen and things go up and down sometimes, and you
Hmm.
start feeling it back and all that stuff. Like, is there a sign that like you like I guess if you find a treatment that works, do you just stick with that, or is there a sign that maybe you should check back in and like do something else? Is it, I guess I'll leave it at that.
Yeah, no, it's a great question. And what's tricky about EoE is that, especially for the swallowing type of symptoms, it's not so reliable just to follow those symptoms by themselves, right? Because people can be really careful with eating, right? And so you could eat really slowly, take small bites, chew really well, drink lots of fluid after every
Yeah, yeah,
bite,
yeah.
and avoid stuff that sticks. And you may feel really pretty well and not have many episodes at all. And it could still, if I do an endoscopy, it could still look really bad. There could be scar tissue and strictures. On the flip side, if I see somebody with a stricture, which is, a narrowing of the esophagus, I can stretch that open during the procedure, and that really makes them feel better. And again, it doesn't treat the underlying condition. So obviously the goal is to have people feeling well. And if you're feeling well, that's great. But I also recommend checking in with an endoscopy. The exact timing of that depends a little bit on the treatment and a little bit on your personal history with the EoE and how bad it might be. But there's, the reason is to check that, make sure the symptoms are actually going in the right direction with how it looks on the endoscopy and biopsies, and make sure the medicine is still working, because some medicines may wane over time. But
Yeah.
we do know that if you stop the medicine, the EoE is going to come back.
Yeah. And that is interesting. That's like a difference I know with like a PPI in specific, like for people who are treating for acid reflux temporarily or something, like they might be familiar with taking it for a week or something, but that's not
Hmm.
that's not the same with EoE.
That's
Um,
right. And you want to be sure that if you're on one of these meds and you're scheduled for an endoscopy, you want to be taking that treatment through the time of the endoscopy so your doctor can actually see whether it's working at that time.
yeah. So I mean, a big question that I get as someone who talks about having EoE is like people who are really struggling with the symptoms and are kind of going through it. Do you have any advice on people who are kind of struggling to find a solution or like get going in the right direction with treatment? Because I think I can speak for myself. It's you can feel lost, and any advice, especially from a doctor, in the field, would be amazing.
Yeah, I think what you describe is pretty common because there's I think a lot of information out there and it can be hard to wade through it. And again, there's this disconnect also between often how you're feeling and what might be going on with the scope. And so usually what I recommend is from the sort of the provider standpoint is I try to do a treatment and then understand if it's working. And if it's not working, whether that's because of symptoms or because it doesn't look good on the endoscopy, to understand why that is before making another switch. Um, and from a patient standpoint, I think it's really important when you go to your doctor to have, questions, concerns, written out. Don't just, you want to prepare for your visit a little
Yeah.
bit, and I always try to find out what people's goals are with their treatment, what their preferences are. Make sure that they can also understand how really you should be taking a treatment, getting checked out for it, following up regularly, that sort of thing. But I think I see too frequently sort of the kitchen sink getting thrown at things like eliminating 12 foods and doing a medicine and not knowing if you're feeling better, but also not getting an endoscopy. And so I think that hodgepodge kind of approach, doesn't make too much sense.
Yeah, I know. I think that comes back to like the educating and obviously like people who are listening who might have celiac disease or are familiar with that. It's like being your own advocate with these things and like knowing that these, you're having these weird things and obviously not everyone knows, we're familiar because we see it every day, but eosinophilic esophagitis like is still relatively rare and people don't like can barely pronounce it. Like I know for me, I couldn't pronounce it for I think 12 months when I was diagnosed with it. So EoE is better to say that, but you can just imagine how scary it is just hearing that word for the first time and be like, okay, what is going on? So, um, yeah, this has been really great to kind of like shed some light on I know really high level stuff, but I guess is there anything else you'd want to add? I guess to kind of finish this out here. I know we had 20 minutes and we're at the
Yeah.
mark here, but anything else? Any kind of closing thoughts that you might have for people with EOE or who are trying to figure out if they have it?
Yeah, so I mean, I think if you've got EoE and you're, feeling like you are a bit lost and maybe, it may not be the right provider, I would recommend reaching out to patient advocacy groups. There are, even though EoE is not uncommon, it is not, super common. It's not super rare anymore. And so I think many allergists and GI docs know about this now.
Okay.
And the patient advocacy groups can direct you in almost any region of the country now to someone who might be more familiar with the condition. So I
Yeah.
think that's one thing. I think if you're someone who is wondering whether you have it, you've got to ask your doctor. And
Yeah. Yeah.
and often if you're going to say a primary doctor, they may say, yeah, but you have to generally go through ultimately a GI doctor to get the endoscopy. There's no other way to diagnose it right now. So that's sort of the approach.
Yeah, I think that's important. I don't know if we've highlighted that yet, but a lot of people ask like, what is the process? And I think that's great. It's like talking to your PCP about it, and then you ultimately need to see a gastroenterologist and get a endoscopy with biopsies and check out the inside of your esophagus. So, well, that's I guess as far as I know, that's the standard of doing
Yeah,
it.
it really is. And some people, so that's I think the common pathway, but some people get there from their primary doc, some people get there from an allergist, some
Oh
people
yeah,
get
yeah,
there,
yep,
unfortunately, if they end up in the emergency room. But
yep,
yeah, people are working on ways to either screen or diagnose it without doing the endoscopy, but
yeah,
it's still these days it's going to be a scope.
yeah. Awesome. Well, that I we're over time here. I want to be conscious of your time. But I appreciate this is really really interesting for me to talk about, and I hope it was interesting for people to hear. This live will be on my Instagram once we hang up here. So if you missed the whole thing or part of it, you could just check it out on my page. So thank you to Dr. Dellon, and thank you to everyone for watching. And yeah, everyone have a good night.
Terrific. Thanks so much, Phil.
Awesome.
Thanks,
Thanks
everybody.
again.